The American healthcare crisis, how the system fails us. America spends more on healthcare than any other country on Earth. Yet, nearly 1 in 10 Americans have medical debt. Over 60% of bankruptcies in the US are tied to medical bills, and in the most advanced country in the world. People die because they can't afford insulin. This is the reality of the American healthcare system. It's not broken by accident, it's broken by design. In this video, we're going to break down why our system fails so many people, how it became this way, and why it hasn't been fixed. If you've ever had a bill you couldn't understand, fought with insurance over coverage, or been forced to delay care because of cost, you are not alone. Let's talk about how we got here. Insurance is a nightmare. Let's start with insurance because for most people, it's supposed to be the safety net. But in the US, that net is full of holes. First, premiums. Americans pay thousands of dollars every year just to have insurance, even through work. Then come deductibles. You can still be on the hook for $5,000, $10,000 or more before insurance even kicks in. And once you do meet your deductible, surprise, you're still paying co-insurance, co-pays, and sometimes out-of-network fees for doctors you didn't even choose. The system is intentionally complex. Networks, formularies, pre-authorizations, claim denials. It's not designed to help you. It's designed to protect profit. And if you don't have insurance at all, one trip to the could cost you your life savings. Big pharma and prescription prices. Let's talk prescriptions. In most developed countries, medications are affordable. In the US, not even close. Americans pay more for prescription drugs than anyone else in the world. Why? Because our government doesn't negotiate drug prices. Big pharma sets the price, and we're stuck paying it. Insulin that costs $6 in Canada can cost $300 or more here. Life-saving cancer meds? Thousands per month. Patents are abused. Companies make small changes just to extend exclusivity and block generics. And behind it all, a mountain of lobbying dollars. Pharmaceutical companies spend millions to make sure Congress doesn't intervene. Hospital pricing and surprise bills. Now let's look at hospitals. Try asking a hospital how much a procedure costs before you get it. Most of the time, they can't or won't tell you. That's because prices vary wildly depending on your insurance, the hospital system, even what floor you're on. A simple visit, $2,000 to $10,000. A few stitches? $3,000. A Tylenol? $20. And then come the surprise bills. An out-of-network anesthesiologist, a mystery facility fee. You thought insurance covered it, but you're still on the hook. Price transparency laws exist, but they're barely enforced. Hospitals and insurance companies keep playing games and patients lose.
Access and inequality. Access and inequality healthcare in America doesn't just cost more, it's also harder to get. In rural areas, hospitals are closing. People drive hours for basic care. In low-income communities, clinics are overwhelmed. Preventive care is rare, and systemic inequality makes things worse. Black and Indigenous Americans face worse outcomes across the board. People with disabilities are often denied coverage, denied treatment, or forced to prove they're sick enough to deserve help. And if you're uninsured, you're treated differently, sometimes literally. Studies show it. Part 5. Mental health neglect. Mental health is health, but the system doesn't treat it that way. Insurance coverage for therapy, psychiatry, or inpatient care is limited, if it exists at all. Many providers don't accept insurance. Those that do, long wait lists, and in crisis, you might get handed a phone number, not actual help. Suicide rates are rising. Depression, anxiety, trauma, all going untreated. We tell people to reach out, but we don't build systems to catch them. Part 6. The toll on patients. All of this takes a real toll. People delay care and get sicker. Some ration insulin. Some split pills. Some go without. Parents have to choose between groceries and a doctor visit for their child. People die waiting for treatment. Or worse, they die because they didn't seek it, fearing the bill. This is not a theoretical problem. It's happening every day. And for many, the stress, the fear, The constant fighting with the system is traumatic. Part 7, why it stays broken. So why doesn't it change? Because the people who benefit from the system have the power to keep it the way it is. Insurance companies, drug manufacturers, hospital corporations, lobbyists, they donate to campaigns, they write the laws, they pay for the ads that scare people about socialized medicine, and because the system is so complicated, most Americans are too overwhelmed to fight back. But it doesn't have to stay this way. We can demand better from our lawmakers, from our systems, from each other. Universal coverage, cost transparency, mental health parity, real reform. The American people are tired. We're not asking for perfection. We're asking for a system that doesn't leave us broken, or buried. If this video resonated with you, share it. Speak up. Support policies that put people over profit. Because healthcare should be about health, not wealth.